Good evening, everyone, and welcome to our live 45 interview tonight. I'm Dr. Jim Sederberg, immediate past president for the ICD USA section, and your host this evening. I'm standing in for Dr. Amrita Patel, who couldn't join us this evening. Recordings of our live interviews are posted on the ICD USA section website at usa-icd.org under the Publications tab. Please use the comments section on our Facebook page to tell us where you're watching from, leave a comment, or ask a question. We'll try to answer all our questions if time permits. Our co-host this evening is our Vice President of the USA section, Dr. Daniel Freed.
Good evening.
Our special guest this evening will be sharing information on the Veterans Dental Care Coalition in Missouri. Joining us are Dr. Jonathan Copeland, Dr. Arnold Jacobson, and Dr. Herbert Silva. I'd like to share a few highlights from all of their bios, and please excuse me while I read through some of their highlights. Starting with Dr. Freed, our co-host. Dr. Freed has his undergraduate degree in Biological Sciences from Indiana University and completed his Doctor of Dental Surgery at Indiana University School of Dentistry in 1975. He followed that with a general practice residency with the United States Air Force in Biloxi, Mississippi in 1975 to 1976. He then served as the Chief of Dental Operations at Baudette Air Force Station in Baudette, Minnesota, and Findlay Air Force Base in Findlay, North Dakota. He developed a certified dental assistant training program there, and he was awarded the Medal of Meritorious Service for all his years of service with the U.S. Air Force. Since 1978, he has been in a comprehensive dental care practice in LaPorte, Indiana, where patients receive gentle, effective dental care that meets their individual needs. He is involved very much in both the community as well as field of dentistry. He is a past regent for District 7. He is a member of American College of Dentists as well as the Pierre Fichard Academy, AGD, and the American Academy of Implant Dentistry. He is a past president and treasurer of the Indiana Dental Association. And most importantly, or I think so, he was the founder of Operation Stand Down, which is a program for veterans, which started in Indiana, has been expanding to other states. He has been involved with many things in this community, as I'd mentioned, the Kiwanis Club, Chamber of Commerce, American Heart Association, Advisory Council, and the Alumni Association for Indiana School of Dentistry. Moving on to Dr. Copeland. He is a 2009 graduate of UMKC School of Dentistry. Following dental school, he completed a general practice residency at the University of Nebraska Medical Center, where he received advanced education in trauma and comprehensive dentistry in a multidisciplinary practice and hospital setting. He's been in private practice in St. Louis since 2010. Dr. Copeland and his wife, Stephanie, also a dentist, have an office in West St. Louis County, where they were named the 40 Under 40 by Incisal Magazine in 2018. Dr. Copeland has achieved fellowships in the Academy of General Dentistry, as well as honorary fellowship in the American College of Dentists, International College of Dentists, and the Pierre Fichard Academy. Dr. Copeland has been honored for his humanitarian and leadership efforts by many dental organizations, as was named one of the 10 under 10 by the American Dental Association, recognizing dentistry's rising stars in 2018. Dr. Copeland has led a Spear Study Club for over 5 years and has focused his practice on managing complex dental implant restorations and comprehensive dental rehabilitations. Thank you for joining us, Dr. Copeland. Dr. Arnold Jacobson graduated from Washington University School of Dental Medicine in 1976. Dr. Jacobson was born and raised in St. Louis. He received his Bachelor of Arts degree from University of Missouri and earned his Doctor of Dental Medicine degree from Washington University School of Dental Medicine. He has an MSPH from the University of Missouri-Columbia, which is a Master's in Public Health for those who might not follow that. He maintains a staff appointment in the Department of Otolaryngology of Washington University School of Medicine. Dr. Jacobson has provided dental care to underserved populations for his entire career and serves as an attending dentist for numerous extended care facilities and nursing homes in the St. Louis area. Dr. Jacobson certainly serves as regent of District 6 of the International College of Dentists and is a fellow of the American College of Dentists and Pierre Fichard Academy. He is a past president of the Washington University Dental Alumni Association and the Missouri-Illinois Dental Study Club. He is on the attending medical staff at Barnes Jewish Hospital in the Department of Otolaryngology and is a member of the American Society of Dentistry for Children. Dr. Jacobson has served our veterans through the Dental Lifeline Network, providing care in his office at no charge, and most recently through the Kauffman Fund, serving veterans in the Metro St. Louis area. He's active in his community as well, serving on the Webster Groves Health and Environmental Commission from 1986 until recently in 2017. Dr. Jacobson has been married to his wife, Joan, for almost 40 years, and they enjoy cooking and visiting with his grown children and small grandchildren. A lifelong college basketball fan, he's a season ticket holder for the St. Louis University Billikens. Thank you, Dr. Jacobson. I've had the pleasure of serving with Dr. Jacobson on the U.S. Board of Regents, and he's a joy to have in the room with us. Last but certainly not least, Dr. Herbert Silva. He received his DMD in 1977. He founded the Chesterfield Dental Associates family practice 38 years ago. He's assistant professor at ATSU, Missouri School of Dentistry in Oral Health from 2016 until present. This is after he chose to retire from active practice. He is in the Comprehensive Care Unit Director, Facilitator of the Veterans Project. He's a member of the ADA, MDA, GS, LDC, and Fellow of the International College of Dentists. His colorful career started when 1967, when he was a commissioned infantry officer, 1968. He was USA Primary Helicopter Training Distinguished Graduate in 69. He was a Vietnam veteran from 1970. He was in the helicopter, he was an attack helicopter pilot, HML 367. Dr. Silva, I'll let you comment on that later if you can translate that. And he flew over 950 missions in support of Allied forces. He was an I-Corps Naval Air Training Command, 1971 Flight Instructor of the Year, Basic Helicopter USMC Reserve, 74 to 77. He is a member of the VFW, American Legion, Marine Corps League, Marine Corps Aviation Association, Marine Corps Combat Helicopter Association, Vietnam Helicopter Pilots Association. Thank you, Dr. Silva. And there was many other things, and he was involved. You were head of the soccer referees or something, but being a soccer player through my collegiate years, so I commend you for that. Well, thank you. Well, Dr. Freed, after all that,
I don't think I can follow that very well. I'm just going to ask a couple of short questions.
I have a sip of water, but why don't you start us out?
Say, hey, so before we find out about more about the Veterans Dental Care Coalition, can you tell us each what had inspired you to be volunteers? Dr. Copeland, can we start with you?
I think it's always been a passion of mine to give back to the community, whether it was, I started volunteering in the local hospital emergency room when I was 15, but always has been just part of what I do. I had my own practice after the GPR at Nebraska, I really got an idea of how lacking the care was for veterans. So that's what I chose to focus on and lean my volunteer service that direction.
Great. Dr. Jacobson, can you tell us how the Veterans Dental Care Coalition came to be in 2016, and how did the Kaufman Fund, how is that connected to the coalition?
Thanks, Jim. As you can see from some of the slides that will follow, we have had several incarnations and names as we've evolved, but in the beginning, it was a small group of dentists gathered with Mr. Kaufman at a American Legion hall. Wayne found us through various tangents that people he knows, and we all had been treating veterans, but we weren't connected to each other. Wayne is the president of the Kaufman Fund. It's a 501c3 charitable organization in St. Louis that provides services for veterans such as legal referral, psychological referral, tax assistance referral, and Christmas trees for veterans. He wanted to expand that, and we started with a pilot project through Dental Lifeline Network, and then we decided that we could strike off on our own and expand through the Kaufman Fund, and now we have a program going in place. And this is a flyer you'll see on the screen for the Kaufman Fund and some of the things they do in St. Louis. We had a coordinator currently, and that's Mr. Steve Rosenblum. He's the vice president of the Kaufman Fund. And currently, veterans are screened through events throughout the year and then referred to the community college for hygiene then to private dental offices for routine care, and then to the school, the ATSU Missouri School of Dentistry and Oral Health, and then back again into the community of volunteer dentists. TKF, the Kaufman Fund, has set up an account at the school, which is pretty much a blank check for the expedited treatment of veterans. So we have a really great sponsor, and we've lined up oral surgeons in the area. Dr. Silva takes students out to remote areas and they take out teeth, but sometimes their ridges are not appropriate for dentures. So we've called upon some local oral surgeons who happen to be fellows in the ICD. That's Dr. Mike Noble, Dr. Stuart Moreland, and Dr. John Monterrubio. You see on the screen now a letter of thanks from the ATSU, AT Still University, to Mr. Kaufman, and it mentions Dr. Silva's efforts to keep veterans' health and their oral health in the forefront. And we have several periodontists and endodontists for the teeth that have to be saved. And we try to keep the process private. It's difficult when we're trying to measure our effectiveness and to seek more funds, stating what we've done in the past. But even though we have HIPAA requirements, we are able to get, especially Mr. Kaufman, I have to keep mentioning him. He's been very generous in funding our program.
Dr. Copeland, can you tell us more about creating the name and the mission statement?
So the name of the Veterans Dental Care Coalition kind of came about because, as Arnie was alluding to, we realized there wasn't a lot of coverage coming to veterans from the VA unless they were 100% disabled, had a combat-related injury. We also realized, with Dental Lifeline Network and Donated Dental Services, there were some outlets there, but we kind of felt it was a Swiss cheese model where there were a lot of holes still. And we were hoping that we could be somewhere where we could cover some of those holes for people by, like Arnie said, working together in the community, working with the local hygiene school, working with Dr. Silva at the dental school, and then getting people back out to the community. So it's the idea of just mainly the name's self-explanatory, I think, other than coalition. The idea of coalition is there's a lot of ancillary help that we get from people in the community. Like Arnie said, Mr. Kaufman, he's just got all these connections to the veterans organizations that help get them to us. And our mission statement, as Arnie said, is to treat these guys, with exceptional care and comprehensive care. It's not just, putting out a fire here and there. We're doing rehabs all the time. So it's nice because it's we believe anyway, it's something everybody can get behind. Everybody has some level of patriotism that they feel that they can give back, I think, to people that have given a lot for us and for our country. So it's been great. And additionally, as Arnie said, we found a lot of guys were kind of doing this on their own in their local private practices and all on our own little islands. And this just helps us get back out together and be a unified front.
Great.
Dr. Copeland, how did you hosting barbecue events start to help with the program?
Well, as you can see there, and that's me, and the gentleman to the left actually is one of the top guys at the dental lab I use. And so it's myself, some oral surgery buddies, a couple other dentists. We all kind of like barbecue and donating to charity. So we figured we'd put the two together and, raising money to put towards the campaign. And that looks like an overcooked pork butt to me that I did. So I have to blame myself on that, but I don't think that one placed that well that year. But anyway, I basically find any reason that I can to, donate money back to this organization while doing something I like. If I could do, fishing competitions to raise money for it, I would do that too. But, that's kind of the way it goes. And same way, with Arnie was alluding to the Kaufman Fund, they do a huge golf tournament that raises tons of money. So really any way that we can find a reason to get people together and throw a little extra money towards the charity, we do it.
Dr. Copeland, your wife Stephanie is an ICD fellow too. Does she work on these events? And if she does, how in the world do you and Stephanie manage to do all this stuff and then manage 3 small children?
Well, I'm glad she's not listening to this right now, because she's asked me that same question several times. And she's right around the corner over there, and I'm hoping I'm going to turn down my volume enough here that I can get through this. But yeah, it's fun. We now work together. We used to have 2 offices, and she just came into my practice, sold her practice, and it's a team effort, no doubt. And it's one of those things where, like you said, she's an ICD fellow, so it sometimes makes for boring conversations around the lunch and dinner table when we're talking about teeth all the time. I'm sure you guys can relate, but with the little ones, we got a lot of family support around here that's helpful, and Stephanie loves to give back too, and she's treated some of the veterans for this program as well as for Dental Lifeline Network. She's a volunteer there as well. So yeah, it's just kind of I guess it's in our DNA. I'll probably have my kids start taking out teeth here pretty soon too. They're in 3rd and 2nd grade, so and preschool. So
Sounds great.
thanks.
Lead by example to those children. That's great news. Dr. Silva, wow, what a background experience you've had, and certainly continue to have. A Vietnam helicopter pilot. I think we've got a slide coming up with that back in the day, standing next to his bird. Director of officiating for the U.S. Soccer Federation for years, and also a dentist. That's quite a career that you've taken on since they retired from active practice and now back into academia. You retired for a few years ago to, I want to read this a little bit here too. I'm so proud of the Marines I served with. On the left is Dr. Herb Silva. Herb was the senior to me and taught me how to save Marines in our Cobras. Herb saved a lot of Marines. Now Herb continues the same manner, saving smiles as a dentist. Herb runs a Saturday free clinic for all veterans. In the picture below, Herb, a Marine, works with another Marine from the Sandbox era, saving them the smile of a World War II Marine who was on Guadalcanal. We say Semper Fi, always faithful, Semper Fi, Herb. I send money from time to time to help Herb. If you want to help, follow this link, atsu.edu/support-mosdoh/vets. And I know that'll be up on our website, so feel free to tap into that if you feel so compelled, and know that any monies you receive, they'll be going to a great cause. But you retired a few years ago, Herb, to teach at ATSU Missouri Dental Dentistry and Oral Health. How's your position of the dental school involved with the Veterans Dental Care Coalition?
Well, the school's a unique situation. We're in it's a partnership with between AT Still University and Affinia Healthcare. We work with the CHC. They're the administrators of the patient load and so forth. After I sold my practice, I sat at home, retired for about 2 days, and she who must be obeyed kicked my butt out the door and told me to go find something to do. And I went down to school right away, and then all of a sudden I was there full time. The students, and we had been active. I'd been active with Dr. Jacobson, Dr. Copeland, and the Kaufman group. We'd all been doing stuff individually in our practices. And the concept was, how can we get it a little bit better organized? Our students, like at any dental school, students need certain experiences. The students need to have essential experiences and become competent at those dental skills, if you will. At some point, again, the school's mission is to serve those in need. Part of what we do is the students get out into the community. We get down into the Boot Heel in Missouri, 3 hours south of St. Louis. The first time that I went down there, we work in a little small clinic that's down there. Students are just doing a lot of extractions. They don't do much follow-up other than that. One of the folks down there in the Dexter, Missouri, we call it the Dexter model. Dr. William Kane had been on the dental board for Missouri, had been doing that for 10 years with a group of local dentists doing extractions once a month. When we went with students, and we could see the experience that it was providing for them. Up on the wall of the administrator that was there was the Marine Corps emblem. So we did our secret handshake and sang the Marine Corps hymn together, and it evolved from there. We said, hey, what can we do with veterans? Do you have veterans? So we came back down with some students that were veterans, some faculty, other faculty that were veterans. That was in 2016. What we did was we created dental cripples, if you will. Everybody that we were treating, the ones that we weren't taking out any teeth that didn't need to come out, but there was a lot of need. So I came back up to school, floated it up to the chain of command, and from the top down, the president of the university at that time was the 125th anniversary of the school. They started it with the grant and it said, hey, see what you can do. So we went back then to our partners, to Affinia, and said, hey, let's not, one of the things that worked for us was, how can we negotiate some reduced stuff so that we can get the students the experiences at the same time treating the veterans. The folks down in the Smiles of Hope, they call it, down in Dexter, they were busing their folks up, and we started every 2 weeks on Saturdays with veterans, with the veterans they were traveling with, and as well as volunteer faculty, and it's been going on ever since. So that part of it's has been really satisfying. The bit with the Dental Care Coalition, it's a part of what we do at the school. We've got the resources of, multiple students needing multiple procedures, and we hooked act up with and made sense with Dr. Jacobson, led that charge, and there's a little bit of how should I say, educating Mr. Kaufman as to what we could do for the veterans, and how he'd get banged for his buck type of thing, because we were doing things that reduced fees, and we negotiated reduced fees on top of that as well. So it's all worked out pretty well, and the veterans are the benefits, are reaping the benefits of that.
Great. What a win-win for everyone involved, including the students, and thank you for guiding them through that process and the giving back. How would you describe all the benefits of the program that you're doing there?
Well, the students get the educational perspectives, and certainly there's value of treatment for the veterans. And many of these guys have been without, guys and gals, I should say, have been without function for so long. We get the interaction between our faculty and our students, between the students and the veterans, is a big thing. The student population, the history that we all lived, it's more than 50 years ago that I was doing my thing in Southeast Asia type of thing. So there's a degree with the veterans that we treated. I think you had the slide up from the Guadalcanal vet. We've had folks from World War II and Korea and Vietnam and Afghanistan and the sandbox, Kuwait and so forth. So the interaction between our students, our campus is split. The first 2 years are the students spent at the university in Kirksville. They share the preclinical education with the med students up there, and then we get them at our clinic for their last 2 years. So we get the interaction between all of our students. Part of their education is learning to deal with the materials, learning to deal with the laboratories, and the sequence and the continuity of treatment over the timeline of what's happening. So they get their essential experiences in getting check marks. Early on, the model at the university, the model here was to treat those in need. We were dealing a lot with Medicaid folks, and in the first year, we didn't see too many. Medicaid generally doesn't provide the denture part of it for patients, and the significant portion of veterans aren't in fact covered by Medicaid. I think that's another number that's of significance. The VA only treats ballpark 10% of the veteran population. They only treat those that are 100% disabled or service-connected disabled or POWs. So we're looking to treat the other 90%, the significant portion of the 25 million veterans that are in the country. We think we've got 500,000 in Missouri. And so we're making a little bit an expansion of what's been going on this is an educational institution, all done by the students. We don't have faculty practice here. We've coordinated with sort of twisting the arms of some of the local practitioners. Dr. Jacobson referred to that with the oral surgeons and some others, if we will, to help us with extractions. And the only thing that we've got on our grants that the veterans don't pay anything for their lower denture or their partial dentures. But if we've got the perio involved, or we've got to do operative, or if we've got to do extractions, then we have to play with that puzzle. So again, it's been a terrific benefit. Of course, the value of it, we could do that in terms of numbers, and I think there was a reference to that in one of the earlier slides with the initial contribution from the Kaufman Fund and Bob Bainan, our financial guy up in Kirksville. But it keeps going on up. But for the veterans, I like to say that for the veterans, it's been priceless. It's been terrific.
Great. How's Mr. Steve Rosenblum and your son, Dr. Jonathan Silva, involved in the program? And oh, by the way, we have heard through the grapevine that young Dr. Silva would make a wonderful fellow of the International College.
Yeah, thank you. I think that's coming from Dr. Jacobson. He's the recruiter there. The new and improved Dr. Silva was one of the ones that early on got his arm twisted to for veterans that needed extractions, and John's been doing that for. He's pretty assertive with doing that, and I think he had 3 veterans in his office this afternoon. He has Warrior Wednesdays on his afternoons off, and Freedom Fighter Fridays, I think, is when he is how he plays it in his office, and it's sort of expanded. We knocked on some doors with some of the dental supply people, and John's liking to do implants like Dr. Copeland's doing as well. And I think we're up to now to double digits on veterans that we've modified, the dentures that we've delivered at school with a couple of implants on the lower arch to give them an implant supported overdenture. So John's actually been terrific. You could talk to Dad. He's pretty proud of that kid. If I can call him in that regard. Steve Rosenblum is the coordinator for the Kaufman thing, as they've now evolved, doing more with the veterans that they've identified through their services that go beyond what we do at the dental school. We're just dealing with the teeth and the veterans' needs there. Kaufman Fund's dealing a lot with their legal needs and all sorts of other cool things that they do with them. But they've now become, I think the word is getting out in the veterans communities, whether it's the VFW, the American Legion, and the various other military organizations, that, hey, there's something that we can get part of. And so what will happen is Steve coordinates with some of the administrators at school that for the other needs that are not covered by our grant. So that the grant that we use to treat and provide the dentures for the veterans is sort of separate from other treatment needs. If they need operative, if they need perio, the hygiene school we were working with for a couple of years, but they've been slow coming back with the pandemic stuff. That's here in St. Louis, that St. Louis Community College, their hygiene program, they provide free treatment for veterans if and when they can get in there. So that's sort of been a missing piece as well. And Steve coordinates the treatment plans, and then the non-removable partial denture, full denture needs that Kaufman pays for, and either the Kaufman pays for or coordinates. Now we're getting to a greater degree. I understand that Dr. Copeland's got somebody that coming up this next week that you're going to be doing some extractions for us, John. Thank you. And so again, that happens that veteran will then hook up with the team of students that we've assigned, and after the healing period and so forth, then we'll take that to completion.
Great. I know that you've done hundreds of thousands of dollars worth of care for these veterans, but what's been the response of the veterans had to this program, and as far as their treatment goes?
Well, look, these are the real things. This is me running around, and yes, we get them to sign waivers on their photos being used for promotion and so forth. But these are some of the results that we're seeing, and from the numbers that we're seeing, and how do we call them completed? But we're looking at the ones this is bumped up from when this slide was made. I think we're up over 280 now. Where we've delivered, we started out again at full dentures. The reason we did that is not knowing if we were going to get other folks to help, and recognize that I thought we started with actually 5 from the first group in 2016 that we did in Dexter, and we did that on a Saturday, and we coordinated Saturdays because I figured with a faculty student ratio of 5 to 6 to 1, I could handle that myself. Well, heck, we've had nothing but we've been doing that every other Saturday since then with volunteer faculty. The numbers have gone up. The veterans then, as we started doing it in addition to Southeast Missouri, if you will, we got into the city and into the county here in the St. Louis area, and it keeps expanding. You can see the distribution of what we're doing. It's involving students from all the classes. We're getting ready to graduate our 5th class, if you will. The incoming class will start in June of this year. We're bumping the number of students coming in by 50%. We'll be going to 63 in each incoming class now. And those students have already been down here, and we do 3 times a year. We do free exams, and we've been having 130 veterans show up at those exams. We think that's going to be expanded. And as I said earlier, I think the value of the treatment for the veterans, priceless. Picture worth 1,000 words. Look at those smiles.
You couldn't have said it better. Thank you.
Thank you.
Dr. Jacobson, you certainly have a great gift as a recruiter, grant writer, and facilitator for the coalition. How many grants do you write per year? Who do you submit those to? And please mention some of the strong supporters you've had over the last couple of years.
Thanks, Dan. I am no great grant writer. Just to tell you, a lot of our funding has been through Mr. Kaufman and the Kaufman Fund, and they don't require a grant. It's talking, and it's much more casual than that. But we have had support from the International College of Dentists USA Section Foundation and the Worldwide International College of Dentists Global Visionary Fund, paired with the Henry Schein Company. And initially, I applied for a grant, a $500 grant. And it was, I have to tell you, for anyone who is trying to create a pilot project, that it is very user-friendly and very approachable, and it was easy to manage. And we obtained a $500 grant, and we've gotten it several times. And those monies, you usually get a check from the ICD, and I forward that to ATSU University, and they forward that to paying for someone's prostheses in the program for her. But we direct that to the, again, we got a lot of different names for the program. I think in that case, it's the Smiles Forward Project, Veteran Smiles at ATSU. But I am no great grant writer. I do want to say, just for a second, that regarding it's being in the genes, Herb's son is a great example of that. He got it from somewhere, and just like a lot of us do from our parents.
Great, thanks.
Thank you.
Dr. Copeland, like all these other veterans programs, we certainly hope that the Dental Coalition expands. How can others become involved in the Veterans Dental Care Coalition?
Well, here in Missouri, we'll have some contact info up here. You can email one of us, Arnie, Herb, or myself, and we can certainly get people in contact with the right individuals. Outside Missouri, I think the one thing that's been the underlining message of this is, Arnie, Herb, and myself are each individually doing stuff for veterans independent of each other before we kind of knew anything was going on. I think the message would be, if you're passionate about something, especially with volunteering, it's likely that other people around you have a similar passion, and 2 heads, 3 heads are better than 1. So seek others out, seek other opportunities out. Go to the usa-icd.org website to look for volunteer opportunities in your area. It doesn't have to be veterans. It's one that's we think a lot of, but anytime in the way the world is now, coming out of the pandemic and everything, especially if you can give a little something back, it's never been a better time for that.
Great, thank you. So for all those watching and listening, that slide will be available on our website. So feel free to contact these individuals if you'd like to become involved.
Thank you. Hey, Dr. Silva, we know with the pandemic, holding any events was probably not possible. Do you have any events planned for the future?
Yeah, the future is now.
With the COVID vaccinations and reaching more people, I think things are starting to clear up.
Yeah, the future for us is now. We again, this is a picture. I think this is some time ago that you can see my boss, Dr. McLeod. That we, again, our dentistry in the community thing, we're now starting to get back up. The counties were closed down in Southeast Missouri, but we've been at school seeing patients since last summer. And I think pretty much everybody at the practitioners at school, we've got our vaccinations, and we've not had any negative incidents like I think dentists throughout the country has done well. But actually, this was just last Thursday. We've been back. The dean is terrific. Again, we can find folks, and it's easier to find practitioners that will do simple extractions. It's a little bit more difficult to get the mandibular tori and the bony exostoses and those kinds of things that get to be a little bit more involved. The dean's terrific. He jumps right in, and these are patients, actually the one that's in the chair there on the left. We identified them from St. Louis. The patient makes the 3-hour drive there with somebody assisting him to drive down to Dexter and get that done. And then they come back to St. Louis and they'll get treated in our clinic. This is the group of students that the students have to do, like I said earlier, they have to do a little bit of the the dentistry in the community to get a check mark in that regard. And we were there 2 weeks ago, I think, on a Saturday, and it was the first time that we'd been there in 14 months. We saw close to, I think it was close to 70 patients and extracted over 300 teeth. And actually, I don't know if this is a way to look at it, but what we're doing is creating the patient pool, the veteran patient pool, for when the new class gets here. We give them a couple of 3 months to heal, and the timing will be right for them to get in there. So here's a good example of Dr. McLeod, who's also, by the way, he was instrumental. I think he set up a mission going to his home, Jamaica, where they go in with dentists and dental students, and they've been going there for, I think, the last 20 years doing extractions up in the hills and so forth, serving the needy. So certainly that corresponds to the international flavor of what's going on. My dad, this goes back again to what Dr. Jacobson was saying, we get it from home. My dad was a World War II Army vet, and I can remember growing up, him kind of beating that in between our ears that, take care of the troops, they sacrificed for you. And as I matured, I don't know if I'd say I matured, but when I did my stint in Southeast Asia, and our job was anywhere, anytime that we were going to go and help the troops that were in trouble. One of our things was the best medal was a live man's smile, and it's just sort of transitioned into that. We did a thing in February, we do 3 free exam groups, timings of a year at school, where we get the patients in, we do an intraoral, extraoral exam, and get a panel, and we start putting the patients in buckets. Who's going to need a full denture, who's going to need partial, who's going to need whatever, before we get him back in for comprehensive care. We do that 3 times a year. And again, our partners have been really great for that. That saves the patients right off the bat, that saves them the bucks. And then we start programming. I go around and I provide the entertainment and get these guys back in and the girls back in. And it's been terrific. We think it's going to continue going.
Great. You guys have all been truly an inspiration. Dr. Copeland, I know we had an opportunity to ask you early on, what inspired you to get involved, but I don't want to leave Dr. Jacobson or Dr. Silva out. So I know there's some history there, but maybe you two would like to comment on what inspired you to get involved with this program.
Well, thanks, Jim. I'm going to give a shout out to my parents. May they rest in peace. But they were givers, and they were volunteers. And my dad was a dentist, and he gave his time. And my mother volunteered at nursing homes, and it rubbed off on me. And it's a good feeling.
Great. Dr. Silva.
Yeah, I should say, I started my private practice, my family practice. I started it from scratch. And in those early days when we're sitting around waiting, looking at the phone, waiting for it to ring and so forth, one of the things that I learned with my time in the military was to appreciate family. And I kind of knew we set up practice where we wanted to raise our family, where we wanted to grow, and still in the same house and still with that same, was she who must be obeyed. Hopefully I'm going to make it to 53 years here in a couple of months. But the timing of stuff, I was able to donate. Troops were going back and forth into what we called the sandbox at that time, and they were done short duration stuff, and I was doing exams on them, and we went out of our way in our office. It wasn't keeping me from doing other things to provide their families with needed care. I think, again, look at the group that you've got, and it's probably going on with individuals within your organization and those who are listening. We do things individually, but there's more in group function. At school, it's easy because I can ring the bell for the students and have a little bit of degree that they pay attention to what I'm saying, rather than when I was in my private practice with my staff. They were telling me what to do. It is what it's going to be. Find out what you can do, whether it's one veteran, whether it's the family member of the veteran. That people that are on active duty don't, TRICARE doesn't do a lot for servicing veterans. Again, I can remember being surprised when I found out that the VA, not to knock what the VA provides. I've never used the VA stuff, though I've had some issues. I've been fortunate enough in other areas to take care of my needs and so forth. But the concept of what we learned in the military to take care of the troops and anywhere, anytime, go serve them. I think that's something that you just got to wiggle your way out and do it. Look within the International College of Dentistry, right? Everyone for Veterans. That was formed from Dr. Chang, and where is she from? The Northwest, and I think you've got dentists identified all over the country, which is a better organized form, if you will, for veterans than donated dental services, which I think we were doing individually, type of thing. I know I was doing a lot of that when it was veterans seemed to go to the top of the list, and that sort of changed. So here at school, I have to be careful because we talk about treating the civilians, and the veterans are a part of what the students do. The students have figured it out very quickly that I kick butt on the veterans if I need to make sure that they show up for their appointments, and so the students are benefiting from that, as are the veterans. And I think that's the future for what we're doing here.
Fabulous. Well, you gentlemen all have huge hearts, including you, Dr. Freed, with, Operation Stand Down Indiana. And with that being said, and, we all have years of experience under our belt, and Dr. Copeland being the youngest member of this audience or our group this evening. But what words of wisdom would you like to share with either the dental students, if they happen to tap into our video, or certainly our new graduates coming out of dental school? And I'll open that up to all four of you. Dan, you want to start?
Well, I think that, being a veteran myself, seeing veterans in my practice that didn't have the money to complete proper treatment, and the VA, unless you're almost totally disabled, you can't get much done at the VA. So it's been very rewarding to have this program get started. I remember when the first time I stood up in a county dental meeting and asked for volunteers, I thought the tomatoes and eggs were going to be coming out, but after about 5 minutes, I had 22 volunteers out of 23 people. It's been a big success, and it's a good feeling.
Great. Dr. Copeland.
For me, like you said, being the junior statesman of the group, I'm out of like 11 or 12 years here. One thing that I found super beneficial is just look to your local dental community leadership. If you're a young dentist, if you're right out of dental school, those guys are leaders in their offices and ladies, and leaders in their community, and leaders within the profession, and start rubbing elbows with guys. And I mean, I feel like I did that a little bit with Arnie 5-6 years ago, and somebody that had a lot more experience than me, and you could kind of see how to do things, see the right way to go through the career, not just how to do the dentistry, but just to how to be a professional. And I think that's an important thing that isn't as easy to find anymore. So seek those people out, and they're almost always more than happy to help. Great.
Dr. Jacobson?
Thanks, Jim. Well, dentistry is a special gift, and the chance to share that with people who are less fortunate is priceless. Herb said before, and there is no greater kindness that you can do for someone than something they can't really repay. And we do get paid. There's a great satisfaction, and we become heroes to our staff and teams in our office. And so we get paid, and enjoy that. I would encourage anybody to reach out, find others who are doing the same thing, and form a group, apply to the ICD, and get some seed money, get going.
Absolutely.
Thanks.
Dr. Silva.
One of the things that's just been very, I get my warm fuzzies, particularly when the interaction that we're dealing with the students, and watching the students bond with the veterans. Young dentists can seek out what's been amazing to me is the receptivity of whoever I've talked to, whether it's been the dental labs, the dental supply people. They want to help. I started off with one of my lines. I did that in the Marine Corps. I was one of the ComShaw artists, we used to call it. You had to go when we needed parts for our aircraft, and we were in the Marine Corps. The aircraft we were flying wasn't in the naval supply system, and we had to go and try and barter and get stuff from the Army supply people north of Da Nang. And I was one of the young guys that could pull that off. It's like they want to help, whether it's the people that are supplying teeth, whether it's the laboratories that are providing services. What Dr. Cheng's doing, I mean, I think she's got faculty. She's recruited folks, whether it's the laboratories or the specialists. I think we heard earlier what Dr. Jacobson was saying. The oral surgeons have got services that they provide that they can provide. We've got the hygiene programs that can do. The question is just start asking some questions and look what you could do. What I'm loving is that our recent graduates are participating. Our most recent visit to Dexter, we had 2 of our graduates that were there. Now we're talking, the students are talking about going to have a reunion there. I mean, I can't imagine that they're going to want to go and take teeth out. I think probably some other things will go down preceding that. But nonetheless, it's a question of what you can do. And maybe the lab's going to help you with a decreased or a lab bill, if you will, to provide that service. And it's just going to take you a few hours of your time. Hopefully you can fit that in after hours or at an early time type of thing. So don't be afraid to be assertive and look to help these folks.
Yep, I think everybody's out there to help with a great cause. And when I've spoken at the white coat ceremonies over the years, I've used the line, there's a price of having initials after your name. And you can choose who you want to donate your services to, be it the veterans or the single parent with children that, or the individual who's out of a job and trying to keep a roof over the head. But we have a unique set of skills that we can provide great things for patients, and I try to instill that in them early. So thank you, gentlemen, for joining us with us this evening. I don't think we have any questions that I've seen come up on Facebook. So once again, I'd like to thank all of you for joining. The email addresses for these individuals will be posted on our website. Please feel free to contact them. The other thing is that it kind of started with the Dental Lifeline Network. If you're not familiar with that, please check that out. It is a great cause and a great opportunity for you to take care of individuals in need and provide them services. So, Dr. Freed, would you like to add anything in our closing?
I just want to thank all 3 of you for putting together such a fantastic program, doing so much good work for the veterans. Your program is going to be available on the ICD website, along with all the other humanitarian programs that we have through ICD. And I'm glad to see you guys join us. It's great to see more members doing the deeds they're doing. So thank you.
Well, I want to thank Dr. Freed for joining us. Our last time that he and I were on a video together, I was interviewing him for his Operation Stand Down, which is also on our website if you'd like to see that. Our upcoming interviews will be on April 21st at 8 o'clock Eastern Time with Dr. Ray Gist, a recipient of our 2020 Outstanding Dental Leader Award. He will be joining us for special Take 20. Dr. Gist is also a former president of the American Dental Association. And join us and find out more about this amazing dental leader. We're not going to have any events in May and June, but we'll be posting soon on our USA website on the events page to see when we'll come out. But I want to thank everyone for joining us this evening, and stay safe, stay healthy, and God bless all of you.
God bless you. Thank you.
Thank you.
Appreciate it.
Thank you. Good night.